The question, I guess, for every one of you. One, to Representative Curtman, when the exchange passed unanimously, I assume you were out of the room at the time. You might want to explain that one later.
Yeah, just real quick about that healthcare exchange. You said it did vote unanimous. Here's the deal. According to Obamacare, every state's supposed to set up an exchange by 2013. Now, either A, the legislature can take charge of the exchange and do it themselves, or B, the governor can go ahead and invite the federal government in to set up a bureaucracy on their own, outside of any control of the state legislature. So I, like a lot of my colleagues, said, you know what, this is a position that we don't want to be in. We're just the legislature. We can't enforce the law. All we can do is say, if we have the opportunity to take it, then give it to us. Because it's kind of like this. I don't know if anybody here's ever thrown a grenade. I've thrown lots of them. Was in the Marines for several years. If I'm locked in a box with the enemy, in this case a liberal governor, and somebody comes over and throws a grenade in, I'm going to do my best to get my hands on that grenade. Because if he gets his hands on it, I don't trust him with it. Now, it's a grenade. I would rather not have it at all. But if that's the box that I'm put in, then I would much rather it be under the control. And in that bill also, at the very end, we did something that at least the governor sure wouldn't have done, is we put in there that as soon as Obamacare is ruled unconstitutional, the whole exchange goes away. But if the federal government would have come in and set up the whole exchange on their own, Obamacare might have been ruled unconstitutional, but now we got a federal bureaucracy operating in Missouri that we can't get rid of. So that kind of puts the question in a whole different perspective.
Paul,
so that's why
I could maybe disagree with you just a little bit.
Well, you can't. I'm just saying from the perspective that we had at the time. That's why. But now it died when it got to the Senate. That's fine. That's great. I'm just saying that there's some people that might voted for it. That doesn't really make them any less conservative. They had reasons for voting for it, and that might have been one of the reasons because it was sure one of mine. And the governor, for example, he wants this grenade to go off because when the Senate was going around the state having hearings on the healthcare exchange, he went ahead and got an executive order all ready to go anyway.
That's right.
So he was wanting to do it. He does not want the legislature to have it. If that gives you any indication of what his liberal agenda might be. So that was just one reason to explain why anybody might want to know why it was I voted for it and the rest of my colleagues did too. It doesn't make them any less conservative. We just see a grenade and we don't want the governor to have that particular grenade. And he wants it.
I think that the grenade, once we pass 609, belongs to us. A couple of points. If you read 609, you'll see that had we set up a Missouri exchange, that we would be responsible for the cost of running that bureaucracy after 2014. We would own it. And when that grenade explodes, we're the ones holding the grenade, not the federal government.
We're already holding it.
That's right.
It's taxpayer money, and we're already holding that grenade.
The other point, I don't know if you're aware of this, but the Cato Institute and the Wall Street Journal both, there's a glitch in the healthcare law where if the states set up exchanges, they have a mechanism for premium support. But if the federal government sets up the healthcare exchange, there is no mechanism for premium support, which is a huge, huge thing. The whole concept of Obamacare is predicated on you paying for your neighbor's health care. You take that away, and it's a huge, huge thing. So I think not passing 609 and Missouri not setting up healthcare exchanges is a form of nullification. We're saying we are not going to participate in our own demise. We're not going to participate in what you're trying to shove down our throat. Once we've passed that, they've achieved triangulation. We've now bought into their plan. We've become part of their plan. And also, if you read 609, it requires the state of Missouri and the bureaucracy that we've set up in their behalf to report on people who have not complied with Obamacare, who have not bought approved health insurance, report to employers on employees. So, respectfully, I think the Missouri House was not doing their job. Sorry.